absolutely does. I did an abstract years ago showing by the fish testing and PCR, Babesia will persist 5 to 9 months after a standard course of clindamycin and quinine or mepron and zithromax. And the problem with Babesia is it suppresses your immune system. So if you happen to have other parasites, like FL1953, Protoxoa rheumatica, or you have intestinal parasites, you have a very difficult time getting rid of these parasitic infections. So some of these patients I've treated, we've given, for example, drugs that treat intestinal parasitosis, and they tell us that they get better, simply because the Babesia was suppressing their immune's ability to clear these parasites. Lyme disease and these chronic infections drive inflammation. This is really what I'm going to explain to you tonight. It should be a very easy to understand concept about how you have to get to all the underlying sources of inflammation. And I'll show you that in the medical literature, we said that 75% of the healthcare costs and 70% of the deaths are chronic diseases. I'll show you inflammation is also the #1 cause of chronic disease. Free radicals and oxidative stress are driving things like asthma, rheumatoid arthritis, scleroderma, strokes, Parkinson's, cancer. All of these different things are also driven by free radicals, oxidative stress, and inflammation. So this multifactorial model is what I use when I see patients who are chronically ill, and the vast majority of these people will get better using this model. I want to expand on the talk just for a second. The National Science Foundation told us, well, we don't really just have to worry about Lyme disease. What they're now telling us about is that there are emerging pandemics, which are threatening global public health and world economies. We can expect 5 such new diseases each year into the future, including Ebola, West Nile, dengue fever, and Lyme disease. So that's the National Science Foundation. What about the World Health Organization? They also anticipate that climate change is going to result in an increased incidence of vector-borne diseases, basically because insects have no control over their physiological temperature, and as it starts to get warmer, the incubation of pathogens will decrease. So what is the report from the World Health Organization? Well, they're telling us we're going to see more tick-borne infections like Lyme and co-infections like Pat talked about. We're going to see more infections like Babesia. Filariasis is also starting to come back. There are viruses like tick-borne encephalitis in Europe, the Powassan, Heartland, and Bourbon viruses, which are viruses that really just we started hearing about in the last couple of years, although Powassan's been around for a while. Fleas in New York City, underneath the New York City subway system, they now found the plague, Yersinia pestis, with Bartonella species. Black flies have filariasis and Bartonella. Infected waters and sails, schistosomiasis. And mosquitoes, parasites like malaria and filariasis, and viruses, such as dengue and chikungunya virus. So global warming isn't having an effect on ticks. And some of you may have seen this article by Rick Osfeld that ticks came out 3 weeks earlier this year. And any of us who have been physicians who see Lyme patients will tell you that many of our patients are coming in earlier with many tick bites. But some of these newer viral infections are also rising, and you may not have heard about this particular virus, the chikungunya virus, but in more than a year, we've seen more than 1.24 million cases in the North America area. And the problem with this particular virus is it causes a symmetric polyarthritis. So you may be dealing with overlapping viral infections, and it's very important to take a travel history in your patients, because if they get dengue fever, if they get this virus, they may come back with joint pain, which is an overlap, and we do see viral infections in some of these patients. But it's not just these type of viruses that are rising. The Powassan virus, a few years ago, in New York State where I live, was 1 to 2% of the ticks. It's now 5 to 6%. So it's basically tripled over a 4-year period. Equine encephalitis virus is up to 10% in Ixodes scapularis ticks in Vermont, according to the Vermont Department of Health. Anaplasmosis has doubled in Vermont in the last several years. And the Vermont Department of Health has told us now that 16% of the dogs in Vermont have Lyme disease. So when I testified before the Vermont Congress several years ago, I let them know that if 16% of Vermonters had Lyme, which is 675,000 people, that would mean that it would cost approximately $1 billion out of their $5 billion healthcare budget to treat simply Lyme disease. And then we have Borrelia miyamotoi, this new relapsing fever Borrelia, which is up to 4% of patients in New England, published in the New England Journal recently. Now, I started looking at relapsing fever infections several years ago, and we did this through Quest Diagnostics. We started checking our patients for another relapsing fever, Borrelia hermsii, and we found that 27% of our patients who were coming in with Lyme were also testing positive for Borrelia hermsii. So these relapsing Borrelia species are around, and again, they may not test positive by the standard two-tier test. But these other infections, like Borrelia miyamotoi, can be even more dangerous because these infections also can get into pregnant women. They can cause hemorrhages, disseminated intravascular coagulation where they bleed out. They can cause strokes, and they cause fetal death. So these relapsing fever infections, we need to start paying a lot of attention to them. Tick-borne infections like Babesia, Pat talked to you about it. I was the first doctor to diagnose babesiosis back in the Hudson Valley in 1999. I found it in a minority of ticks, where I took those ticks from the Institute for Ecosystem Studies with Rick Osfeld. 16 years later, Rick Osfeld is now finding Babesias in more than 40% of ticks in our area in the Hudson Valley. So just like we're seeing elevated rates of Powassan virus, this deer tick virus, and anaplasma, relapsing fever, we're also seeing tremendous increase in the amounts of babesiosis. Lyme is clearly going up. The CDC told us it's gone up at least tenfold. 1.3% of respondents in 2009 and 0.9% in 2012 had Lyme. We know that the numbers are quite high because if you figure out that the number of people with chronic fatigue syndrome and fibromyalgia and MS and autoimmune diseases, which are great imitators for Lyme, there are probably many more millions of people who are walking around at this point. But it's not just Lyme and Borrelia miyamotoi. We're also seeing rising incidence of other Borrelia infections. There are 15 new species of Borrelia that have appeared in the past 10 years. That's more than one new Borrelia species per year that is starting to appear in the environment. And the last one they found in California, Borrelia basseti, was implicated as a human pathogen in Mendocino County. They now know in California, when you look at the tick population, you have about the same possibility of getting Lyme disease as you do Borrelia miyamotoi with a tick bite. Pat talked to you about the different ticks versus the Lone Star tick, which can come at you at 50 feet away, smelling of carbon dioxide and heat. And then, of course, we have the problems with larvae. Now, you heard about the larvae, that the larvae generally are not thought about having Lyme disease, but there is one exception to the rule, and that is Borrelia miyamotoi. They've now found that 6 to 73% of the time, the mother tick can transmit Borrelia miyamotoi to the eggs, so directly without a blood meal. That means that Borrelia miyamotoi is probably going to be the next rising tick-borne infection we're going to see very rapidly because mother ticks are transmitting it directly. Lyme can present as a flu-like illness, so it's difficult in the summertime. You might think that someone has the summer flu with fevers, fatigue, swollen glands, sore throat. What I like telling people about Lyme, this is very important, especially if you find the EM rash. If you have a stiff neck and a headache, light sensitivity, sound sensitivity, dizziness, memory, concentration problems. With an EM rash, it's gotten into your central nervous system. That means that 30 days of doxycycline is not going to cure it. If you have an EM rash, but you have tingling, numbness, and burning in your extremities, neuropathy-type symptoms, it's gotten into your peripheral nervous system. You are not going to cure it with 30 days of doxycycline. So please know that if you have central nervous system symptoms or peripheral nervous, you are going to need to treat this for a longer period of time. The erythema migrans rash, of course everyone knows about it, but what you may not know, and Pat talked about it, is this rash is seen in starlight. And when I went out to Missouri and I looked at the prior work by Ed Masters, what's interesting about, they still haven't identified the Borrelia species, is that if you look at the western blots, and you look at the bands on the western blot that were reported by Ed Masters, most of the bands on the western blots are exactly the same Borrelia-specific bands that we're seeing in general. But Borrelia miyamotoi can also cause an EM rash. So you can have an EM rash from scar eye, from Lyme disease, and Borrelia miyamotoi with exactly the same symptoms of Bell's palsy and meningoencephalitis.